This study is funded by a medical device company started by two experienced pain management physicians. I thank you very much for coming and helping with this important study. The company is looking at two different heat settings on the study device to test which heat setting works best at relieving pain. The most important item today is the assessment of your pain level both before treatment and as the study progresses. To rate your pain, we use a pain scale, specifically the numeric pain scale, NPS. Pain is hard to measure as it's an individual experience and because there is no machine to give us a rating. We can't tell a person's pain level by looking at them. Instead, we rely on the individual to tell us their pain level using scales like the NPS. The NPS goes from 0, which is no pain, all the way to 10, which is the worst pain you could ever imagine. At one end, we have a 0, which is a relaxed state with no pain. At the other end of the scale is a level of 10 pain, which is the worst pain you could ever imagine. The pain scale has 3 sections. Mild pain is a level 1, 2, or 3. A moderate level, 4, 5, 6, or severe, 7 to 10. A key to getting accurate results is for us to agree what this scale means. For instance, a level 1, 2, 3 is mild pain. Mild pain is described as annoying. It is annoying, but really doesn't stop you from doing things. For mild pain, most people wouldn't even need to take any medication. The next section is moderate pain, a level 4, 5, or 6. Moderate pain is uncomfortable and interferes with your concentration and starts to affect your ability to do things. People with moderate pain usually want to take something or change what they are doing. Moderate pain affects your enjoyment of life. Finally, severe pain. A pain level of 7, 8, or 9 is intense and overwhelming. It is hard to concentrate, hard to relax, and very hard to get around. With severe pain, you can't ignore it, and you want something done now. When you report your pain, first consider, is the pain level mild, moderate, or severe? Once you've determined the general level, what is the number you would assign to your pain? So, if the pain is at a moderate level, is it a 4, a 5, or a 6? The number you select will be your pain level. You will be tested numerous times during the study, as we are interested in any changes in pain over the course of this study. If your initial pain was a 5, and now you've had treatment, is your pain level the same as a 5? Did it get worse as a level 6? Or is it less, say a level 4 or 3? Use your baseline pain number as an anchor. If your baseline pain was a 5, how does your pain now compare to your baseline level of 5? If you think it is less, then your pain level is some number less than 5. If your pain is unchanged, it's probably still a 5, and if your pain has increased, it's a number greater than 5. Remember, all pain level options are possible. Your pain may improve, stay the same, or increase. There is no right or wrong answer. We only ask you to provide an accurate assessment. This study is randomized. That means that each person who enters the study is placed into one of 2 study groups. This is done randomly, like the flip of a coin, heads or tails. Your placement is not affected by things like how long you have had your pain or pain level. In addition, you will only be exposed to one of the groups. You will not experience the other group. You'll never really be able to compare your experience to those who have received the other device. So don't feel that you need to give a positive response, just an accurate response. There is no right or wrong answer. You could be in any of the 2 groups. This is done to give us the most accurate pain assessments based on what you experience and not what you expect. We expect that some people will have no change in pain, others will have less, and maybe some will have more pain. The important thing is that no one you meet during the study will know or ever know what group you're in. We treat you exactly the same as we have no idea what group you're in. So don't try to please us. Just try to provide accurate pain ratings. This is a study and not a clinic visit. We expect that some pain levels may change or may not change during the study. There are no trick questions. We don't want answers that you think may please us. Remember, this study is only about your low back pain. Sometimes subjects have multiple areas of pain in addition to their low back pain. The device on the low back will not treat those pains, and in some cases, reducing low back pain may unmask other pains. So when you rate your pain, please focus only on the low back pain and not on any other pains you may have. Thank you for helping us learn more about treating pain. Your participation in this important study may help many others who suffer from chronic pain.